All right, so welcome. This morning we are doing some foam rolling, and we're going to start with the lower leg and into the quadriceps a little bit. And so let us begin. So you're going to pick a leg. Let's take one leg atop the roller, just above where the heel and the Achilles tendon, then it gets a little bit meatier. Okay, where it starts to get a little meatier is where we're going to begin. You can add extra pressure if you need it. You might not need it by crossing the leg over, pushing, or pushing this way. Okay, so you have a couple different options. So I want you to also make sure that you keep your foot here relaxed. Don't let it tense up. Okay, so we're going to do nice big circles, keeping the toes relaxed, applying as much pressure as you like, and other direction. Good, and relax. And a little iron out, just bending that leg and just kind of moving across the tissue. Good, so we're going to stay in the same place, but we're going to go to the outside edge a little bit. You're going to apply extra pressure as you choose. Keep your bottom foot relaxed and let's circle. So some of you might think it's boring, circle the other way, to start with the lower leg. You want to get to some of the sexier, bigger muscles. But your lower leg is so important. Go and relax. The muscles of the lower leg control the movement of the ankle, also affect the knee, and have everything to do with the foot. Good. Let's go to the inside edge. So if your foot and your ankle aren't working properly, nobody above it's going to work properly. Okay, let's do a big circle. You might find it's a little more tender or bruised feeling here. And often that's because there's some overactivity on the outside of the leg, which we'll address in a little bit. Good, and a little iron. Good, let's come back to center. So we did one section in that lower leg. You could do, if you have long legs, you can maybe do another section below the bulky part of the calf muscle. But today we're gonna move on and we're going to, first thing I like to do is just kind of explore and roll through a little bit. We're gonna roll through and kind of just explore, see if you feel any knots, see if it's tender. Maybe it doesn't have any sensation. Okay? Maybe you're like, oh, I clearly have some spots. So we're going to do 4 spots on this portion of the leg, the bigger medial bulk muscle area. So I'm going to do 2 on the roller, 1 using my kneecap and 1 using my hands. You're welcome to stay on the roller the whole time or follow me or make any alterations that are right for your body. So I'm going to find a spot on my roller. I'm going to apply extra pressure as I like. And then we're going to circle the foot. Circling the ankle, keeping the foot relaxed. Let's go the other way. Good, and relax. Let's take a deep breath in, flex the foot up, and flop. Inhale, flex up, and flop. Again, breathing deep into the belly, and flop. Good, let's find another spot. And if you have a really knotty spot, what you're hoping to feel is to feel that muscle at some point just kind of go and melt and relax. So find your second spot, big circle. Other way, big circle. Relax, inhale, flex up and flop. Inhale, flex up and flop. One more time, flex up and flop. Good. So you're welcome to do another spot on your roller. I'm going to use my kneecap because it's a nice hard little pointier surface, but not pointy sharp. And I'm going to find one of my knots that I want to get into deeper. I'm going to hold my leg. I'll find that spot. Ooh, right there. So you could also do this seated in a chair or with your back up against the wall, can be a little more comfortable. It's, it's a little uncomfortable to have to hold myself here. Circle other direction. Good, and relax. Let's inhale, flex up and flop. Flex up, deep breath and flop. One more time. And flop. All right, we're moving on to the 4th spot. Again, you could be on your roller, you could do another one on your knee. I'm gonna lay my foot across the roller just to elevate it so I can move my ankle more freely. I'm going to use my hands. I'm going to dig in and really feel that tissue and look for one of those knotty spots. And big circle. Other way, big circle. Good, and relax. Inhale, flex. And flop. I like you to use your hands sometimes because it really teaches you how your muscles move when you move certain things. And I think it's really important. Good. All right, so we are done with that portion. We're moving on to the outside of the leg. So we're going to change position. So whatever leg you were working is going to bend in front. The other leg's going to bend back out of the way. If this isn't an option for you to sit like this, it's fine. You can come over here and straighten that leg and be more comfortable, okay? We're going to take our roller, and it's going to go perpendicular underneath our lower leg. Okay? If you have a longer roller, it's just going to stick out further, okay? We're going to think of two sections. So from where it just starts to get meaty about midway up, and then the second section. If you have really long legs, maybe you do 3. We're going to apply extra pressure by pressing down with your hand. You're going to iron it out a little bit. And we're going to take a little scrub back and forth. So kind of wiggling your leg friction-wise across the roller as you move up and down. And let's circle. Circle through, move up a little bit, pressing as little or as much as you like. You might get little ankle pops and cracks, nice releases. Some people hate this area. I love it. It's kind of that hurts so good. We're going to move up to the second section. Okay, so I'm just going to shift my roller just a little bit. Press down. I like to press up here a little harder. And now we're going to iron through. So moving from about midway up to the outside of the knee. Good. And I'm going to scrub back and forth, letting my foot be floppy. Back and forth, back and forth. Good. And let's circle through. All right. So we're going to switch sides, but if you would like to feel the difference in between, go ahead and stand up, walk around a little bit, see if you notice the difference. Sometimes it's subtle, sometimes it's really dramatic. Try a squat, see if your knees feel like they move differently in a squat. Try a hip hinge where you bend over, see if that leg feels more flexible in the back, up the whole leg. And also one of my favorite things to do is hop on the one leg that we did, and then hop on the other leg and see if you notice a difference, okay? While you're doing that, we're gonna switch to the other side. So we're gonna start, same thing, just above, there's the heel bone, then your Achilles starts, and then it starts to get a little meatier, but below the bulky part of the calf, so that in-between spot. And again, really important that this area is nice and loose, because it does affect the ankle, especially with ground force impact. That means if you're running, if you're jumping, if you're doing anything where you need that rebound and you need that power and you're hitting the pavement or whatever, this is critical. It will take so much stress off of your joints when this area is working properly. So let's apply our extra pressure. Keep your foot relaxed and let's circle. So if you're a runner, especially if you're a marathoner, circle the other way. You do long distance running, this will add years to your running life. Good, and relax. And I have a lot of people who have done this. I've worked on them right before a race when they've been training for months, and they have taken minutes, several minutes off of their personal record. Just by making sure this is optimally working, affects the whole body. Let's go to the outside. So we're going to rotate out a little bit, apply extra pressure, big circle. Other way. Good, and relax. Now, I don't really advocate stretching your calves in the traditional sense. This, you'll get far, far more benefits out of foam rolling and release of these muscles. Let's go to the inside. In fact, so about a third of the population, your calves will maybe get a little bit of flexibility if you were to stretch them. About a third of the population would really see no change at all. And about a third of the population, if you stretch your calves, they'll actually rebel and they will tighten up and get worse. Good, let's release. And let's go through the bulky part. So we're moving up to where it's meatier tissue. We're in the gastroc, kind of moving around. Because of the nature of what your calves do, they respond really well to this type of work. All day long, they're stretched out to keep you from falling on your face. So if you think about a muscle being stretched out all the time, what is stretching it more going to do? Not much, and in some cases, piss it off. So we're going to do 4 spots again. I'm going to do 2 on the roller, 1 on the knee, 1 with my hands. You could follow along with me, or you could stay all on the roller. You have any freedom between those. So I'm going to find a good knot here. I'm going to cross over and big circle around. Try to keep your foot relaxed. Other direction, try to keep your foot relaxed. Inhale, flex up and flop. Inhale, flex up and flop. Inhale, flex up and flop. Good, let's go find another spot. Besides being great for your running, your running life or your active life, big circle. This work is really, really great for relieving cramping at night, especially lower leg cramps. Really important for helping resolve plantar fasciitis. Let's inhale, flex up and flop. I've had multiple, like over a couple dozen people cancel plantar fasciitis surgery and never need it, even years later, after switching to this and stopping trying to force the stretch. Okay, so I'm going on to my 3rd spot. So I'm going to use my opposite knee. I'm going to find a good old knot in there. Again, you can stay on your roller. Sometimes it takes me a second because it's kind of rolling. There we go. Big circle. And other direction. Got a couple nice little snappy pops of release out of my ankle. Go ahead and relax. Inhale, flex up and flop. Inhale, flex up and flop. 1 more time. Inhale, flex up and flop. All right, let's take this foot. Again, you could be on your roller regular. You could do another one on your knee. I'm putting my foot so that I have room to move it, and I'm going to use my hands. I'm going to find a spot in there that I really want to get to a little bit deeper. One way you can think about your lower leg is think about all these muscles in here, and there's multiple muscles like puppet strings. And your puppet strings control what your ankle and your foot are able to do, and that controls all of your movement. How you walk, how you squat, how you run, how you dance, everything. Okay, so if your puppet strings are tangled up or stuck together, you can see how that would affect the movement of a puppet. It's going to affect the movement of your body. Inhale, flex up and flop. And that's why it's so important to take some time on the lower legs, especially if you're a really avid runner or hiker or on your feet a lot or have any issues, foot issues, not emotional issues. All right, let's go to the outside. So again, you're going to bring that leg in front. Okay. This leg could tuck back, or again, you could come here if that's more comfortable. The roller is going to go perpendicular, longer roller sticking out further, and you can apply. Maybe you don't want any pressure. Maybe you have just a little. Maybe you really lift down. And sometimes if I want to get even deeper, I'll lift my hips up a little so I can put a little more body weight on there if my arm can support it. So we're going to work the first half. And let's take a little scrub back and forth. Circle. So you're moving up and down as you circle. Oh, I don't know if you heard that. That was a good release. Good. And let's move up to that second half and iron it out. And again, sometimes here, I want to get in a little deeper. I might lift up. I might just push heavier. Let's scrub back and forth. And let's circle. And as we're finishing up on this section, another component to really remember is hydration. If you don't have enough hydration in your muscle tissue, they start to get sticky and stuck to each other. They cause movement problems, all sorts of things, okay? And when your body's low on water, okay, it lets your hands and feet dry out first because it is going to protect your organs. So it's gonna bring all the water here and not so much out here. So when you get, that's why a lot of times people get really stiff in the hands and feet first, is because of that lack of hydration. And it's chronic in most people. All right, so we are done with the lower leg section. If you want to stand up and feel a difference, you can walk around, you can do some squats, you can touch your toes, you can do the hop thing again. And we are going to move now to our quadriceps. I'm just going to check our, we're going to move to our thighs, and that is where a ton of tension and issues are in our quadriceps. So both from if you're super active and you have really strong legs and overwork your quads, and also if you sit too much, they can kind of create the same ball of circumstances and cause a lot of the same problems. So the good news is this addresses both of them. So we're going to start with the roller. We're going to do two sections. We're going to do from our knee up about the first 5 or 6 inches. Okay, and then the second section. You'll probably get a little crossover here, totally fine, because it's usually a pretty bad area. So we're going to start just above your knees, on your forearms, body nice and level. So you get a little bit of core bracing work here. Your feet, you'll notice mine are on the floor. If your legs are up here, that is a big indication of a lot of tension. So you want to be able to relax the legs, and you might be thinking, oh, but that hurts really, really bad, okay? It might, probably does, but it will get better. So try to keep your toes relaxed, and let's move up and down that first 5 or 6 inches. The amount of tension that's held in these muscles is really incredible. And the implications it can have for your posture and your movement, relieving back pain, are huge. So let's stop just above the knees, okay? Again, try to get your toes to sink to the floor. We're gonna start to kick, like you're in the pool splashing water, floppy kick. And now you're gonna move up and down through that 5 or 6 inches while kicking. And I guarantee you feel like you're kicking big, and you're probably like this. Make it splashier. Splash that water all over. Good, stop just above the knees, okay? I'm gonna give you 2 options. You could kind of swish side to side, which I kind of call mermaid, or you could open and close like a little baby jumping jack. If you have a shorter roller, that might feel like you're gonna roll off. So baby jumping jack is a little better on a longer roller. And you can move in between, you're gonna move up and down. So maybe you do a couple mermaids. Okay. Maybe you do a couple baby jumping jacks. And maybe you're like, oh my gosh, I hate her. This really hurts. Good, and relax. So in that section, I want you to find the biggest knot that you can, okay, something that feels like you need to address, and you're going to get on that knot, and we're going to bend one leg, keeping the foot relaxed, and lengthen out. And then the other leg. And if you need to slightly shift and roll because your knots are in different, slightly different places, one's a little higher or lower, you can slightly shift when you switch legs. So again, keeping your foot relaxed and lengthen out. If you feel like you can't bend your leg, okay, that is a huge amount of tension that needs to be taken care of in your quadriceps. Let's do one more each side. And if you feel like you get up here and then your leg whoops down or whips down, whips, that would also signify a lot of tension. Good, and relax. So now we're going to move up to the next section. So we're going to iron out through that next 4, 5, 6 inches. Might be more tender, might feel better, might be just about the same. It will be one of those 3. Good, let's stop and let's start the kick. Kick and move. Keep your belly button drawn in and lifted. Keep breathing. Good, let's swish. Mermaid back and forth. So maybe you do one mermaid and then maybe you do a jack. Swish. Good. Get on the worst or best spot, depending on your perspective. And let's do the big slow leg bend. And lengthen out. Don't let it whip out. Control it. Other side. Try to keep your foot relaxed. And remember, you can slightly shift. Good. Do a couple more. So people always ask, well, how often should I do it? When should I do it? Do it when you'll do it. If you're running, I would definitely make sure to do the lower leg before you run. If you have some lower back issues and different things and you sit a lot, I would do the quadriceps, this every day or just about every day. Make sure you're hydrated. All right, let's go and push back. All right, so that concludes. And oh, by the way, sometimes after people do the quads, they come to sit like this. They're like, oh, I can't normally sit like this. Or maybe doing the standing quadricep stretch, maybe doing a lunge. Things may feel different. You might stand up and feel taller because those muscles pull us forward. When those muscles pull us forward out of position, our butt can't do its job, our back can't do its job, and then those feel tight, and our hamstrings feel tight. So really important strategy overall is stretch and release the front of the body and then strengthen the back of the body. Because until the front's released, it's really hard to make progress on the back. So that was the lower leg series and the quadriceps series. There's lots of other things that we will do, and have a great rest of the day.